Colon cancer is the cancer of the large intestine or rectum. It is one of the leading causes of cancer death in both men and women. Most colorectal cancers are due to old age and lifestyle factors, with only a small number of cases due to underlying genetic disorders. It typically starts as a benign tumor, often in the form of a polyp, which over time becomes cancerous. Early detection and treatment can lead to a cure. Risk factors of colon cancer include a high-fat diet, obesity, smoking, and lack of physical activity. Dietary factors that increase the risk include red meat, processed meat, and alcohol. Another risk factor is inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis. Some inherited genetic disorders that can cause colorectal cancer include familial adenomatous polyposis. Hereditary non-polyposis colon cancer. However, these represent less than 5% of cases. Colorectal cancer may be diagnosed by obtaining a colon sample during a sigmoidoscopy or colonoscopy. This is followed by medical imaging to determine whether the disease has spread. Screening is effective for preventing and decreasing deaths from colorectal cancer. Screening, by one of several methods, is recommended starting from 50 to 75 years. Here are 10 warning signs of colon cancer. 1. A change in bowel habits, such as diarrhea or constipation lasting more than a few days. Constipation and diarrhea can be vital warning signs, especially if either persists. Constipation can be due to a tumor obstructing the smooth passage of defecation. This can manifest as a narrow stool as the tumor compresses the stool. This narrowing can also be caused by diverticulitis or colitis. However, other causes of constipation and diarrhea should be ruled out. 2. Rectal bleeding, even if it's just a drop or two. This is seen as blood in the stool, and piles commonly cause it. The veins around this area can become friable and cause bleeding during bowel movements. The bleeding from a pile or hemorrhoid is usually red. A dark red or black stool can be a sign of colon cancer. It can also be due to gastric or stomach ulcers. Whether bloody stool or rectal bleeding is dark or red, it is essential to have it checked. 3. A feeling that you haven't emptied your bowels after a bowel movement. You may feel like you haven't emptied your bowels after a bowel movement. This feeling is called tenesmus. Tenesmus can be caused by Crohn's disease, irritable bowel syndrome, or infections. It can also signify colon cancer, where a tumor prevents complete evacuation. 4. Persistent cramps or abdominal pain, especially if it's lower on one side of your body. As the tumor occupies space, it may cause pain or cramps. In addition, a tumor can block blood vessels in the colon, restricting blood flow and causing pain. Abdominal pain is often common in people later diagnosed with colon cancer. If you are experiencing repeated abdominal pain, go to your doctor to have it checked, as this may be a warning sign of colon cancer. 5. Unexplained weight loss or a decrease in appetite. A big part of most cancer is unintentional weight loss and loss of appetite. Colon cancer is no exception. People older than 50 with rapid unexplained weight loss should rule out colon cancer. Significant weight loss without trying should be checked. 6. Feeling very tired all the time and lack of energy. Colon cancer can cause fatigue and weakness. If there is persistent fatigue, despite adequate rest, it could be because of anemia caused by colon cancer. Symptoms of anemia are pale skin, faster heartbeat, dizziness, and shortness of breath. If you are experiencing unusual fatigue and tiredness, you should have it checked. 7. Nausea or vomiting. Colon cancer affects the gut and can lead to persistent nausea and vomiting. However, multiple other causes of nausea and vomiting should be ruled out. 8. Shortness of breath, especially when you're active. If the colon cancer spreads to the lung, it can compromise breathing. 9. A lump or mass in your abdomen that you can feel. This should prompt a visit to the doctor to have the mass checked. 10. Swelling of the abdomen. This can happen as the tumor gets bigger. An abdominal CT should be obtained for unusual or unexplained abdominal swelling. How to reduce colon cancer risk. 1. Eating a variety of fruit, vegetables, and whole grains helps you get the nutrition you need for good health. They contain vitamins, minerals, fiber, and antioxidants that reduce cancer risk. 2. Keep yourself healthy. If you're already at a healthy body mass index, BMI, combine a healthy lifestyle with regular physical activity. If you want to lose weight, talk to your doctor about healthy options for achieving your goals. 3. Limit alcohol consumption to 1 to 2 drinks per day. 4. Exercise most days of the week for at least 30 minutes. Maintain a healthy weight. There you have it. Thanks for watching. Please subscribe and comment below.